Have you ever looked at your child's vaccine schedule and thought, why are there so many shots? You're not alone. I'm Dr. Jay Rutland, and today on the Health Exchange, we're bringing back a familiar friend of the podcast, pediatrician Dr. Lori Livingston. She's going to break down the vaccine schedule step by step, what each shot does, why it matters, and how it keeps your child safe. Let's get into it. Lori, it's nice to
Hi.
have you back.
Thank you for having me again.
We're going to talk about vaccines. We're going to talk about the vaccination schedule because we both understand the importance of the vaccination schedule. But why do you think vaccines bring up so many questions and emotions for the families that you see every day?
It's a great question. I think that when people have an infant, a newborn, their whole perspective changes on what they're exposed to and what their child is exposed to. And so they want to protect this perfect
Yeah.
infant that hasn't been exposed to anything and question everything that they do in a way that they never questioned before. I'm sure you experienced this with your children. I did too. I never questioned vaccines, but I think it's normal to question, okay, wait, why am I doing this? What are the ingredients? What are the side effects? Because this is a human being and it's their child. So they're all valid questions. And there are quite a few. There's more vaccines than we had when we were children. I think most parents don't understand what these infections are. They often haven't seen any of them or know anyone with these infections. And vaccines have done such an amazing job of getting rid of or almost eliminating or making rare these infections that people don't worry about them anymore.
Yeah, our protection plan for our kids is based on our experience. Do you have a patient story or an experience that has really stuck with you from a vaccine standpoint?
When I was a resident, the hospital was full of babies with rotavirus infection, so vomiting, diarrhea, dehydration. These are young infants that are so dehydrated, it's hard to get in an IV to rehydrate them with IV fluids. They have so much fluid coming out both ends, and we're trying to keep track so that we can rehydrate them. We had to do all kinds of crazy things to try to make sure we weren't giving them too much fluid, but they needed enough. And they were in the hospital for days with scalp IVs and IVs in crazy places. And it's really traumatizing for the infant, for the family. And then the rotavirus vaccine started to become more widely used during my training and after, and it virtually eliminated hospitalizations from rotavirus. We don't see that. We see it very rarely now. Sometimes in older kids, they get dehydrated, but it's amazing. I mean, the hospital went from being extremely busy to nothing during rotavirus season.
That
That is incredible.
Yeah, it's a very impactful story. I mean, for me, the story I always use now is just when a 67-year-old guy was dying of SARS-CoV-2 infection. And he was like, give me the vaccine, give me the vaccine, give me the vaccine. And I said to him, I can't right now. It's too late.
Yeah.
And when I think about vaccines and illness, one of the things that a lot of people don't think about, and you just described it, is it's not just life and death. It's also the impact of the clinical scenario. In other words, individuals being admitted to the hospital. Yeah, you're going to get through it and you're not going to die from it, right? Especially with
Maybe.
rotavirus. Really, you might not die from it.
In another country, maybe.
Yeah, right. But to get through that requires a lot of stress on the healthcare system that may not be necessary because of the invention of a vaccine.
And traumatizing for families. Honestly, that stays with you forever, that experience of your child being poked and crying and being in the hospital for days and not sleeping. It's very scary. And if we can prevent that, at least for some infections, it's incredible.
Yeah. The vaccine timeline, right? From the moment a child is born, there are certain vaccines that we recommend.
Every pediatrician does things slightly different
Mhm.
with the timeline because there's ranges that vaccines can be given, but yes.
So take me through the vaccines that are important, say the first couple years of life.
So the hepatitis B vaccine is given typically in the hospital after baby's born in the first couple days. And then at 1 month old, we give another Hep B vaccine. And then 2, 4, and 6 months old, the DTaP, polio, Hib, which is Haemophilus influenza, pneumococcal vaccine, and rotavirus vaccine. So 5 different vaccines that are given at 2 months, 4 months, 6 months, and that's when babies are most vulnerable to those infections.
And you give them all at the same time, all 5 of them?
There are combo vaccines, but yes, they're given at the same time. So it reduces the number of pokes, but all of those vaccines are given at each of those ages. So booster doses at 4 months and 6 months,
And
right?
that's essentially why we do it, is just to reduce the number of needles that the kid is gonna get.
Absolutely, which is important because it's the worst part of vaccines for kids is the needles. At 1 year, MMR and chickenpox.
MMR is measles, mumps, rubella.
Yes. There are booster doses of some of the ones we already mentioned at 15 months and 18 months. We didn't talk about hepatitis A vaccine that can be given at a year or 2 years old. Preteen teen vaccines, booster for tetanus and whooping cough, Tdap, the meningitis vaccine, we say meningococcal bacterial protection, and the HPV vaccine.
And the reason why we get so excited about vaccines in general is really because when you look at science, when you look at what has happened over the course of time, like in the 1800s, when we first kind of established that microorganisms lead to disease, that's when we actually could look through a microscope. We can see these little tiny organisms, whether it was a bacteria, which are the kind of the things that we saw first. And then we started to be able to scan with an electron microscope the way viruses looked. When you think about all of these organisms that are present in the environment, they have a significant impact on the diseases that we see. Why? Within your body, in your bone marrow, you've got white blood cells that are developing, they're growing up. It's kind of like your home. But you have a home and you grow up in your home, white blood cells grow up in your bone marrow. What their responsibility is to recognize bacteria, recognize virus, bind to those viruses, clear those viruses, kill them, get rid of them, right? But in the process of doing that, they release certain inflammatory mediators to warn the body. And those inflammatory mediators is actually what leads to disease. It leads to diarrhea that she saw with rotavirus. It leads to the pneumonias that we see in streptococcal disease. It leads to meningitis because you have white blood cells present within your central nervous system. And that's what can damage the brain and your spinal cord. It transitioned my way of thinking. So I went from thinking that the organism caused the disease to more of it was our immune system's response to the organism that actually led to the disease, which is sort of where vaccines begin to come in, right? So these organisms impact children. They can kill children. They can cause serious disease in children, leading to hospitalizations. We have to vaccinate kids because we want to protect our kids, right? They're our future, and that's what we want to do. When you vaccinate against certain diseases, it actually leads to a better prognosis overall when these kids come in contact with these actual infections. But I know when my kids got vaccinated, like I just remember like a lot of kids in the area who had just been vaccinated, and there's a fair amount of laughter that can take place when a kid gets a shot. I mean, I'm not saying like, you should laugh, but sometimes it's funny. Do you have any funny vaccine stories?
Well, I mean, it sounds like a horror movie in my office sometimes because the walls are pretty thin and there's screaming happening everywhere at one time or another. So I'm often in a room with a teenager and there's a child screaming next door, and I'm like, I promise we don't torture children here. But yeah, kids elope. I mean, I've had teenagers bolt from my office down the street, and we can't find them because they don't want a vaccine. My own child, who knows my office well enough, so exited the room and was running in circles around the office away from the nurse to avoid a shot.
So you have the nurse do your dirty work?
Oh, yeah, we do. The nurses, I feel bad for them. They're hated.
I remember my kids were getting flu vaccine one year, and at the time they're like 4 and 7, and I had a long time ago read this strategy where if you cough, you don't feel the needle prick
Hmm,
because apparently the cough reflex gets in the way of the pain reflex when it's traveling up through the brainstem. It gets jumbled and you don't feel the needle.
'kay.
So I had tried it a couple of times and it worked. So I told my kids, I was like, listen, if you just cough, you're not going to feel the needle, right? So my 7-year-old was about to get the flu vaccine, right? And so she's like, "Wait, Dad, what'd you tell me to do?" And I was like, "Cough. Just cough, 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 cough," right? And so I said, "Close your eyes, though." And so she coughs, gets the vaccine, cough, coughs, doesn't feel anything, cough. And she opens her eyes. She's like, "Did I get it yet?" And I was like, "No, you haven't gotten it yet." And she's like, "Oh no, it's gonna hurt. It's gonna hurt. It's gonna hurt. It's gonna hurt." And I was like, "Use your mouth." And she was like, "Oh, I didn't feel anything, Dad." And I was like,
Nice.
"It's fine."
Haven't heard that one.
Yeah. Vaccines, the way that they work is, first of all, you have to understand how infection works. Organisms, whether it's a bacteria, whether it's a virus, they're composed of different structures. When they enter your airway, when they enter your bloodstream, they're trying to bind to your cells. They want to bind to your cells. Now, most of the organisms like to bind to a salicylic acid that's on your cell membrane, whatever the case may be. They're going to bind to your cell. Your immune system recognizes them binding to the cell. And in the process of that recognition, after initial inflammatory mediators are released, they're going to cut up the organism into different pieces. They present these different pieces to dendritic cells. Dendritic cells are like, okay, cool. They present these different pieces to B cells. B cells, all right, I got it. And they make antibodies. T cells make receptors that are going to recognize these different pieces of organism, right? This is just how infection works, all right? Like, if you believe in microbiology, this is how it works. Okay. If you don't want to believe in microbiology, fine. You don't have to. But this is how infection works. Vaccines do one of two things. You're either weakening an organism, right?
Mhm.
And when you weaken an organism, basically you're taking out structures that can lead to severe disease. So, in other words, you're taking out structures that are going to activate the inflammatory response a lot. That's one way of doing it. And then the other way of doing it is you actually take a piece of the organism and you inject that piece of the organism, and your immune system recognizes that piece. So when the organism actually shows up, it knows what that piece looks like.
Yes.
Because you have to know what the organism looks like to be able to develop a vaccine, meaning you got to know all the structures of the organism, all the proteins. You got to understand which proteins lead to disease, so on and so forth. When you look specifically at hepatitis B,
Mhm.
which is an organism, a virus, a DNA virus that infects the liver, what's the significance of hepatitis B in babies?
So, the reason there's a universal recommendation for the hepatitis B vaccine at birth is because babies get hepatitis B from their mother generally, and their mother not knowing that she has hepatitis B. A lot of adults are walking around with hepatitis B and don't realize it because it can be a pretty mild infection in adults. But if babies get it passed to them from their mother, then they can rapidly develop liver failure, need a transplant, dying, the worst case scenario. So this has become a universal recommendation because not every woman has access to adequate prenatal care to see if everybody has hepatitis B. If women have prenatal care and are tested for hepatitis B, then we know that their infant is at much lower risk, but it's not perfect. You get tested for hepatitis B early in pregnancy, and technically a woman could get hepatitis B before delivering her child. So it is a very common infection, and that's why we protect babies at that time. If they're not vaccinated at that time, then they have potential for exposure when they're in school, right? Blood and bodily fluids is how that virus is passed, and kids share a lot of bodily fluids, not blood all the time, but that virus lives in any of our bodily fluids potentially.
Another vaccine that we talk about a lot is DTaP or Tdap or whatever, whatever,
Order of
however you want to
letters.
say, whatever consonant you want to say first. All right. But the organisms we're talking about are diphtheria, tetanus, and pertussis.
Correct.
Why is it important for these children to get this vaccination?
So the main one that we worry about now in current times is pertussis, which is whooping cough. It is life-threatening, again, for young infants. They can just stop breathing. Apnea is common with pertussis. We give that vaccine to infants starting at 2 months old because that is when they're most vulnerable. That vaccine is also given, the adult version of it, to pregnant women, hopefully every member in the family, to prevent them getting pertussis and giving it to that young infant before they're fully protected.
Yeah.
It is a vaccine that is important for the community to protect our most vulnerable, which are the infants who can die from whooping cough. And this has been in the news lately in some states that there have been whooping cough outbreaks, and these babies are admitted for a month because they just keep having breathing problems. They're on oxygen, and it's terrifying.
And when you look at this organism, Bordetella pertussis, what you have to remember is organisms can produce toxins. There are 3 main toxins that we talk about. What these toxins actually do is they activate the inflammatory response, and that's what leads to a lot of patients' symptoms. So what these toxins do is they do a number of things. One is they don't allow the immune system to go to the area where the infection is. Another thing that they do is they actually kill some of these epithelial cells. And when these epithelial cells, the cells that line the airway, when they slough off into these small airways, they can cause obstruction. And when you cause obstruction of these small airways, that's what leads to apnea and why these infants die. What else is this vaccine protecting us?
So diphtheria is the D, which is hopefully continues to be a fairly non-existent infection, but it caused severe throat infections and also trouble breathing, and I think potentially death if that was a serious enough infection of the airway, the throat. Tetanus is still alive and present, usually an infection that's in the soil, a bacteria that's in the soil, and that most people know if you have a dirty wound, then that puts you at risk for tetanus infection. So particularly school-age children and older need that protection. And that vaccine, those have traditionally been together, the DT and the P. And that vaccine has changed over time to make it safer, cause less side effects. So the version we have now is actually much safer and we have much less reactions compared to the version that we got actually when we were children.
So when you look at these vaccines, one of the things that you mentioned is you mentioned with pertussis, you want the entire family to get the vaccine.
Yeah.
And you want the entire family to get the vaccine because it's so infectious, right? Bordetella pertussis, we call it the R naught, which is how many people are you going to infect if you're infected? And with Bordetella pertussis, the R naught is almost on the order of measles. It's like 16, 17. So if one person gets infected, that person can infect 16 or 17 other people.
Yeah.
And so that's why it's important for the entire family to get that vaccination.
And they think they just have a cough. It's just an annoying cough that they've had for a really long time, and they don't think that they're contagious. So that's why it can spread so easily as well.
Right. And you can treat it with antibiotics. Like it's actually relatively, if you catch it early enough, it's relatively easy to treat. But if a
Mm.
baby gets it, pertussis
Yeah.
is deadly in
Yeah.
kids.
Yeah.
And vaccination has drastically improved that, right?
Absolutely.
So if you don't get a shot, you're just putting yourself or your child at risk of developing a life-threatening infection.
Yeah.
Something in you that might be cough, but something in them that could be death.
Yes.
And that's the problem.
Yeah. They're life-threatening infections. That's
Now-
why we have vaccines.
100%. There's another organism, another disease that's almost been eliminated from society, at least in the United States. And that disease is polio.
Yes, in the United States. Although there was polio detected in wastewater in New York City or outside of New York City, a couple years ago. So it is still around, but because of almost universal vaccination, that vaccine has been around for so long and is well accepted, we don't see polio in this country, but there are absolutely cases in other countries, and as we all know, everything is a plane ride away these days, and a lot of these infections do enter our country from foreign travelers because we all travel a lot these days. It's still a possible disease that anybody that's unvaccinated can contract and causes paralysis and death.
Here's what I want people to understand. Like a lot of times I'll have patients come in and be like, well, I got this vaccine, but I got infected. And I'm like, yeah, but you're at home. And so I want individuals to understand that vaccines, they don't prevent infection per se. They prevent disease. They prevent your immune system's response to the presence of this organism, an overactive immune system response. So it doesn't surprise me that infections or that infectious organisms are still around, right? That means these individuals are protected from the disease that these infectious organisms cause. And I think it's a very important point because vaccines are not force fields, right? Vaccines are training the immune system to recognize the presence of an organism quickly, to neutralize all of the consequences that come with that organism. That's the point. So when we say things like polio is eradicated, it doesn't mean that that organism is no longer living in the environment. It means that the organism cannot cause disease in us because our immune system recognizes it quickly and clears it about as fast as it gets in us. And I think that's very important for individuals to understand when we're talking about vaccines. My question to you is what's the most intense disease you've seen that could have been mitigated by a vaccine?
Pneumococcal meningitis, I would say, pneumococcal infection bacterial infections can cause something as minor as an ear infection and as severe as sepsis, bloodstream infection, meningitis, pus around your brain, basically, that has to be drained. It's really crazy. And that is an infection that can be prevented, and our pneumococcal vaccines have gotten better over time as well. They cover more strains of this bacteria to prevent more infections in kids, and it's something we see less and less, which is awesome.
So there is a vaccine against pneumococcus. It's strep. Strep is normally the organism that's causing pneumococcal disease. But talk about pneumococcal disease.
So, like I was saying, it's a very common bacterial infection. There are, I don't know how many strains, but different strains cause different types of infection. So, ear infections, upper airway infections like sinusitis, lower airway pneumonia is extremely common, but as severe as sepsis, a bloodstream infection, meningitis, and those are extremely life-threatening infections, and even pneumonia, depending on the age of the child. Young infants are much more vulnerable to these infections because their body is overwhelmed much more quickly than a grown child or adult. But also, elderly people, we're protecting them with these vaccines as well. There's pneumococcal vaccines, right?
Right.
It's a scary bacterial infection. We still see it because we can't prevent all of the types of pneumococcus, but the strains that seem to cause the most severe disease are in the vaccine, and it works well.
When you look at the different strains, the different serotypes of streptococcus, it's all based on the way it looks on the outside, right? And so when you look at bacteria, like I mentioned earlier, some bacteria are housed by different structures, and these structures have different proteins, different sugars that are attached to them. And so that's the way that they look different. But when you look specifically at their DNA, right, they are that organism. It's just the way that they're housed that looks different. So what you try to do is you try to discover which strain is causing the most severe disease. Another way to ask that question, which strain tends to overactivate the immune system the most, right? And then when we understand that, then that's the strain that we protect against, and that's the specific strains that we'll put in these different vaccines. But another organism that you talked about that we vaccinate against is rotavirus. What's rotavirus?
Rotavirus causes vomiting, diarrhea, severe. It has a particular odor. The nurses in the hospital could tell you without testing if a child had rotavirus. Just extreme fluid losses from vomiting and diarrhea. So dehydration is rapid. And unless you have access pretty quickly to medical services and particularly IV fluids, that kind of resuscitation for hydration, you can die of dehydration and the electrolyte, sodium, potassium abnormalities that come with dehydration that are required for all of our organ function, right? So, worldwide, this infection kills hundreds of thousands of kids, but in the United States, not everywhere. There's rural areas that don't have access. Those kids are extremely high risk for severe dehydration and possibly death if they don't have access to a facility that can take care of them in that situation. So, we live in a place in Los Angeles where there's 3 children's hospitals within a very small radius. So these kids get taken care of quickly, but still they require IV fluids and sometimes their veins are collapsed when they're dehydrated and they have to have an IV put into their bone to rehydrate them. It's a terrifying thing to see your child that dehydrated and lethargic and limp, and that's what happens, and balancing their electrolytes is very important too, and it requires nuance that most people don't understand, and I'm very thankful that we have a vaccine that essentially, we see mild cases, but we really don't see severe cases of rotavirus anymore thanks to vaccination.
Influenza or flu,
Yes,
right?
we
A
do.
lot of patients ask me, why do I have to get a flu shot every year? Talk to me about influenza.
The flu, influenza, because people call lots of things the flu. Some people call a cold the flu or vomiting and diarrhea the flu, but the flu is influenza, and it is also a life-threatening infection. It's really one of the worst. I mean, predictably high fever for several days, cough, pneumonia is a common complication of the flu. So we talk about this a lot for young kids. Kids under 5 are extremely high risk for complications from the flu. Pneumonia, bacterial infections on top of the flu. So the flu itself can cause pneumonia, a
Yeah.
viral pneumonia, and then getting a bacterial infection on top of that, whether it's strep or pneumococcus or whatever, they're more vulnerable to that because their airways and their mucosa is compromised, right? So this is how children and adults can die from the flu. Flu can also cause meningitis, viral meningitis, and all kinds of other viral effects on the body. Hepatitis, viruses can affect the liver, but generally it is life-threatening because of those secondary bacterial infections that people get, and people don't always seek care immediately because they think, "Oh, I have the flu, and I'll be fine. I just need to sleep it off." And that is dangerous. So, yeah, we worry about young kids, and I really push hard for influenza vaccination because it is an infection we still see a lot of kids hospitalized for.
Influenza doesn't just infect human beings, it can infect birds and other mammals. And when you look at it, influenza is an RNA virus. And so at times, RNA from an animal flu infection and RNA from a human flu infection can kind of combine and the virus can live on. And that can cause these severe pandemics of influenza, like you guys have all heard of, like H1N1 and all of that. That's because, part of the bird flu and part of the human flu came into contact with one another and they exchanged RNA. And what it does is the structure of influenza, you've got these proteins on the outside of the membrane called hemagglutinin and neuraminidase. Our immune system recognizes those specific proteins, but every single year, the hemagglutinin and neuraminidase can change the way they look slightly. That's what happens when influenza from the bird and influenza from humans meet each other. These hemagglutinin and these neuraminidase proteins on the outside look completely different. And so your immune system goes haywire and it's like, oh my God, what is that? And it rushes all these cells there. If it's in the lung, that's really bad pneumonia. And when you get that really bad pneumonia and your immune system is focused on influenza, the virus, well, there's a bacteria back there that the immune system's not focused on because your lungs aren't completely sterile. And that bacteria overgrows. And when that bacteria overgrows, you get something like staph pneumonia on top of influenza. And that's what kills people because your balloons are just full of all these cells and you can't breathe any longer in your lungs and end organ, and then you die. And
Yeah.
that's the unfortunate consequence.
It's a tough vaccine sometimes to convince people to get because it's not always super effective, right? It's a prediction about what strain of flu might be circulating, but we do know that it at least reduces the severity, right? And every parent comes to my office. We're so busy in flu season with fevers up to 105, 106, extremely high fevers, and parents are so worried. And I usually say, like, this wouldn't be as severe with a flu vaccine. They might still get it,
Yeah.
but less severe.
Right. And again, a lot of people ask the question of, well, I got the flu and I got vaccinated. And again, I always answer that question by saying, yes, but you were probably at home when you got it. And you might have felt like crap for 18 hours or 24 hours or 36 hours.
Yeah.
But I want you to imagine a scenario where you didn't get vaccinated. Would you have felt crap for a week? Would you have missed work for a week? Would you have missed a paycheck for a week?
Yeah.
Or would you have been admitted to the hospital? So I see people with influenza all of the time.
Yeah.
And these individuals have risk for severe disease because they've got COPD or they've got asthma or they've got something else that contributes to that. Just shifting gears now, getting into some other types of organisms. Again, we kind of mentioned this, but hepatitis A,
Mhm.
that's fecal oral transmission as well. We see that in kids. It can cause severe disease in them
Absolutely.
either.
Yeah, absolutely. Usually, foodborne outbreaks are common for hepatitis A. So, and in certain populations, it's more common, but you'll hear regularly about hepatitis A in some frozen food that you bought at the grocery store or Costco. And it can be a mild infection, but it can be a severe infection causing liver inflammation, liver failure. It can be so severe that somebody requires a liver transplant. That's why there's a vaccine for it. And again, young kids are more vulnerable to these infections causing more severe disease. So that's why we recommend them earlier.
That's why, because so we want kids to get that vaccine because they're more susceptible to this virus.
Not necessarily more susceptible, but the complications are more common. So, more severe liver disease versus an adult who can get very sick but has more reserves with a bigger body, a bigger liver, there's more reserves. So sometimes it's less severe. But those little bodies can only take so much inflammation.
One of the infections that has been making a comeback lately, and we see it all the time in the news, we saw it in Texas recently, is measles. And there's a measles, mumps, and rubella vaccine.
Yes.
What are we protecting against there? What's the consequence of having either of those infections?
These are viruses. There's no antibiotic, there's no medication to cure it, right? If you get these infections, and they are, again, life-threatening infections. Measles, people are learning about again because it has made a comeback because of pockets of unvaccinated communities where it spreads like wildfire that are not you were talking about earlier. Measles is airborne. It lives in the room long after somebody's gone, so it spreads very easily. And if you're vaccinated, the vaccine is very effective with one dose that we give at 12 months old, typically. But infants under 12 months old are not protected. And so measles causes high fever, a classic head to toe rash. That's what people generally think of. But measles can cause viral pneumonia, meningitis or encephalitis, severe infections requiring hospitalization, sometimes never recovering completely. It actually wipes out your immune system. So you have to start over to build your immune system if you have a measles infection. Our parents lived through it, so a lot of them say like, "Oh, I had measles." And that makes people feel like it's not a big deal.
Yeah, I mean, in the 50s, 60s, about 500 deaths of kids we would have before the vaccine was made available to everybody. Now, once it was made available to everybody, you essentially had no deaths until, I don't know, the last few years, I guess.
Very few, yes, but yes, more in this last year in Texas, 2 children died, unfortunately, from measles, and that was acute measles infection. That was basically pneumonia, an overwhelming infection, and again, there's no antibiotic, so there's there's no treatment. We need these vaccines to prevent these infections, and they're not new, they're safe. It's unfortunate that there's so much misinformation that is scaring people.
When I was 8 years old, Janelle Stockton lived across the street from me, and Janelle Stockton got the chicken pox.
Mm.
And my mom was like, "All right, Jamie, go get chicken pox. Go to Janelle's house." So I went to Janelle's house. I got chicken pox. It was awful. I had all these like vesicles all over my skin. I was like bathing myself in calamine lotion in the tub.
Mm.
And my mom and my brother were just sitting there like laughing, like, you're going to be fine. You just have, these vesicles all over your skin. Now, the whole concept of vaccination was actually born from smallpox, and we can get into that later.
Yeah.
But nowadays, kids don't have to go through that.
Mhm.
What changed? Did you go through chickenpox?
I
Did you?
did,
Yeah.
I did. I have a scar on my face, and lots of people have scars
Yeah.
from scratching, and the reason there's a vaccine, which this is one of those ones that we lived through, and so lots of people say, "Why should my kid get a vaccine? I'm here, I'm fine, it wasn't that bad," and you forget how awful it
Yeah.
was. You remember, apparently, but I don't really remember, I just know I have a scar, but it's again, high fever for several days, you're contagious for a couple weeks, you can't go anywhere, you can't go to school,
Yeah.
all these itchy spots, and kids get infections on top of that. So bacterial infection on top of the virus, and that's how they end up in the hospital. So kids do get severe bacterial infections that require hospitalization and antibiotics. Also, varicella can cause, just like lots of other viruses, meningitis, not as common, meningitis, encephalitis. And those kids may or may not survive and have complications from those things. So that's what we're trying to prevent is those severe manifestations of that virus. Yes, for some people, it can be more mild, but if you knew someone who had severe chickenpox and had complications from it, you would feel differently about the vaccine. You would think it was really important. And I think this is why education needs to be better so people know why we're doing this.
Yeah. Human papillomavirus.
Yeah.
Now, in my career, at least growing up in med school residency, that's when this vaccine came out. So for
Yes.
me, like I understood that HPV led to cervical cancer,
Yes.
right? So females that were infected with certain HPV strains
Yes.
would develop cervical cancer. And then they came up with a vaccine for HPV. Tell me about HPV cancer.
Yeah, and now known it's associated HPV is associated with lots of other cancers of the head and neck, which have been on the rise in men and women. Cervical cancer being the most well-known complication from HPV infection, and I think HPV, again, there's hundreds of strains, right? You get warts. Everybody goes through having warts at some point during childhood. And parents look at me like in shock when I say that that is HPV. That is certain strains of HPV that don't cause cancer, but there are certain strains of HPV that are cancer causing strains. We don't know who will get cancer, right? Some people won't, even though they're exposed to this virus, but many people do and lose their lives because of these invasive cancers. And again, if you know someone who's had cervical cancer and either survived or didn't, then it's a no-brainer. Those families want the HPV vaccine yesterday
Yeah.
because it is HPV, these strains we're talking about that cause cancer, it is a sexually transmitted infection. So young kids, hopefully, are not exposed to that virus until they become sexually active, which nobody knows when that will happen. We like to think we know what our kids are doing as they grow up and they're more independent, but not every parent knows what their teenager is doing. We give them the vaccine when they're young before there's any chance of exposure to these strains of this virus, and your immune system responds better to the vaccine at a younger age. We actually don't have to give as many doses if we give it at a younger age. But as you know, the vaccine is approved up to 45 years old now because it is so safe and effective at preventing cancer. It's been long enough now we are seeing less cancers because of this virus. It's an incredible feat of science. Even if you have one sexual partner your entire life, no guarantees that that person doesn't have HPV. So
Men
that's
and women get it, right?
some
Boys and girls both get it.
absolutely, yes. Sometimes that's the reason parents give, well, we don't believe in sex before marriage and my child is waiting, and that's wonderful. I am all for that, but you can't guarantee that the person that they end up with followed the same rules, and they might have HPV and give it to your child. So everyone needs to be vaccinated
Yeah.
to prevent cancer. Do it when you're ready. I don't care if you're 9, which is the youngest they can get it, or 25, if that's when you can make the decision yourself as a human being and not have your parent telling you what to do. It is an incredible vaccine that's life-saving.
Another organism we protect against, especially college age kids, is Neisseria meningitis, right? So
Yeah.
Neisseria, which causes meningitis. Neisseria is very, very virulent. It's a severe organism. We can protect against it now.
Yeah, it's a rapidly life-threatening infection, and again, that's the reason the vaccine was created, is because even though it's not a very common infection, it's extremely contagious. It spreads rapidly, again, airborne in group settings. So we give it at starting at 11 years old because kids go to sporting events with their teams or summer camps, and there are outbreaks every year. Anybody who's exposed has to take antibiotics to prevent getting it, and that person who gets this infection is lucky if they're alive, honestly. It is so rapidly life-threatening and terrifying, and you often don't know until it's too late, right? Because you think you have the flu or something yucky, and you just need to sleep it off, and then it's too late. So again, a life-saving vaccine that we give when kids are most vulnerable. So those preteen, teen years, and then college, there are always meningitis outbreaks or meningococcus, sepsis. Sepsis is actually a very common manifestation of this bacterial infection and causes death rapidly. So it's really scary. And most people understand that and are willing to get that vaccine. It doesn't have interestingly enough, the negative connotations that some of the other ones do. I think because people realize how scary that infection is.
Yeah, no, and again, you can treat it too with antibiotics, third generation cephalosporins and such. But I always tell my friends' kids, my nieces, my nephews that are going to college, I'm like, listen, if you're having sex and you got a massive headache and you don't get headaches, you need to go to the doctor. That's generally what I tell people, and I tell them to worry about this infection. So that's just a piece of advice that I offer people that are close to me. When we look at COVID-19 or SARS-CoV-2 infection, I just want to talk about that vaccine for a moment.
Yeah,
Do you recommend it to kids?
I do. We do. As a practice, it's approved for kids 6 months and up. We carry it at my office. It's not a required vaccine for school, right? But again, young kids are more susceptible to severe infections. And recently, with this recent COVID strain and outbreak, the hospital has had a lot of kids with COVID, really like the only thing that was in the hospital and full, and not enough nurses because of the respiratory complications generally for kids having trouble breathing. The vaccine, much like the flu vaccine, doesn't necessarily prevent infection every time, but helps to prevent the severe complications of COVID infection, whether that's vomiting, diarrhea, dehydration. I mean, COVID causes every single problem there is. Trouble breathing. We have teenagers that have had long COVID in my office, prolonged fatigue, brain fog, trouble breathing, miss school for 6 months plus because they can't function, and it can prevent long COVID.
Yeah.
So, I do recommend it for those reasons. There are downsides to the vaccine. The immunity doesn't last very long, so it's hard to time when to get it. If you're getting it once a year and there's 3 waves of COVID going through every year, when do you when do you get the vaccine? But we have seen safe and effective. We haven't seen severe side effects, so for
When
what it's worth.
yeah, when I look at SARS-CoV-2, right, the way that I think about it now is in adults, individuals that are in my clinic because they're seeing me because they have a lung disease, they need the SARS-CoV-2 vaccine, right? And what the vaccine does is it allows the immune system to recognize it quicker so people can get through it a lot sooner. And if you get through it a lot sooner and your immune system recognizes it, perhaps you won't have those symptoms of long COVID, so on and so forth. There are treatments for it too, right? We can give adults Paxlovid to help inhibit the reproduction of the virus itself. The other thing is when you look at vaccines, right? Everybody wanted to give a lot of attention to mRNA vaccines, right? And they were like, oh, mRNA vaccines are the devil. They're causing all these issues, whatever. mRNA vaccines do have certain side effects, and they can, not for everybody and not on, every single person that received one. They can, but you got to remember with SARS-CoV-2, there are protein vaccines as well. They're traditional vaccines for SARS-CoV-2
Mhm.
that you can go and seek out and get that one as well. It's just as effective.
Yeah.
So you don't have to get the mRNA one if you are afraid of the mRNA vaccine. I got no issue with it. But now we have options. So we can't just say, oh, the COVID vaccine did this. There's a traditional vaccine for SARS-CoV-2 infection. And so the people that I recommend should get it are people that have lung disease, people that have heart disease, people that have chronic illnesses that when those cells are particularly infected, it puts their life at significant risk.
Yeah. And the thing about kids, they commonly don't have as severe an infection with COVID as adults, but they live with adults.
Yeah.
And they have grandparents and they have teachers and they have all these people around them that are high risk for more severe COVID infections. So it is a public health issue in protecting each other, even if your child had a really mild cold. Did they, because it's airborne, spread it to everybody around them at school and their grandparents and cause a life-threatening infection for somebody else? So this is where it gets complicated, right? People don't feel like they need to get a vaccine for something that's a mild illness in their child, and I get that. And I'm not super pushy about it for healthy school-age kids, but I do say, if you have grandparents that are around or other people that you care about that are high risk, then I would think about getting it.
I just want to say this because I think that it's important to talk about respiratory viruses. And the respiratory viruses we talk about are influenza, SARS-CoV-2, and respiratory syncytial virus. We haven't talked a lot about RSV. The reason I want to bring it up today is because of this. Respiratory syncytial virus can cause severe respiratory infections in children, right, age 0 to 5. Cause inflammation of the bronchioles, which are carrying air to the lung. They act like an asthmatic. They wheeze, they cough, they produce a lot of mucus. And they produce a lot of mucus because one of the proteins in RSV can stimulate the goblet cell to make more mucus. And these kids can die of airway obstruction. They get mucus plugs, they die because they can't gas exchange any longer. But we now have a couple of different therapies for RSV, right, to protect against severe disease. One of those therapies is a monoclonal antibody
Yes.
called nirsevimab
Yes.
in the newborn as soon as they're born, right? And
Yeah, 0 to 8 months old qualify for that treatment. Again, a life-saving treatment of our generation. Hospitals full of RSV infected babies, not happening so much last year because it was more accessible last year. The first year was a little bit of a mess with accessibility and cost, but last year, so many more women were able to be vaccinated, pregnant women vaccinated with the actual vaccine, and then infants don't get the vaccine, they get the antibody, which just binds to the virus if they do get exposed and prevents severe disease for the vast majority, preventing hospitalization and what you described, ending up on a ventilator and sometimes dying from this virus. So
Yeah.
it will change the face of my job.
Right. So you've got monoclonal antibodies for the babies when they're born, and you've got vaccines, Abrisvo specifically, for pregnant females. And I can't remember if it's 32 to 38 or 34 to 38 weeks, something like that.
Yeah.
Right? They can get vaccinated against it. They're going to make antibodies. The antibodies when in the placenta are going to protect the baby, and the antibodies when you breastfeed are going to protect the baby. That's another way to protect the baby.
Yeah.
Here's a big question I ask my elderly patients. My elderly patients, and I'm talking patients that are over the age of 60, 65 years of age, I ask them, I say, hey, do you have any grandkids that you take care of, and how old are they? Because if they're in that 0 to 5 age, just like Lori was talking about protecting the baby, I also want to protect the elderly. And so I want to make certain that they're vaccinated if they're babysitting that little grandkid of theirs, because RSV is so everly present in that population of patients. And
Yeah.
so it sort of works both ways. And so as somebody who sees a lot of families, these are conversations that we have around this time of year because these respiratory viruses are becoming more prevalent. Now, I know I talked rapidly, so right now we're going to go into rapid fire. We're going to call this segment Quick Shots. All right? So
Clever.
we've covered all the big stuff. And so I'm going to ask you these quick questions, and I want you to tell me what you think right away.
Okay.
Flu shot, arm or thigh, what's easiest for kids?
Depends on their age. Sorry, JB. Thighs, generally in younger infants and young children. Arm in older kids, just because I think is less scary. They don't have to pull their pants down. But young infants have chubbier thighs and they're less likely to have as much pain. So they get it in the thigh. The booty is universally more painful, so we don't give vaccines there anymore. But both, basically, yes.
Booty's more painful. You heard that here first.
Yeah.
Okay. Which vaccine do you think is the biggest game changer in history?
I wish there was a simple answer. I think it depends on the generation, right? Our parents would say the polio vaccine.
Right.
I have told you today for my career, the rotavirus vaccine and now the RSV vaccine and antibody are going to eliminate illnesses that I had to take care of. It's insane. But for my mentor's generation, the pneumococcal and Hib vaccines, they were doing spinal taps in the office. We don't have to do that anymore. We don't worry about those infections the same way we used to. So, yeah, we didn't get those vaccines when we were little, and we were lucky, I would say, that we didn't have bacterial meningitis. So, yeah, I'm sorry, it's all of them.
Well, I'm going to give an answer because I want to give an answer at the rate at which individuals were dying and were presenting to the intensive care unit. I am going to sit here and tell you that I think the vaccine that was the biggest game changer in history is the SARS-CoV-2 vaccine. The rate at which I saw people dying, how many iPad conversations I had to have with family members that couldn't be in the room of their loved one that I was disconnecting from the ventilator.
Yeah.
All of those things, as soon as the vaccine became widely available, it plummeted. I don't care who you are or what you think. It had a profound impact on what I saw, and it was directly correlated with that vaccine. So for me, it was, and I know I should answer the question.
Absolutely. No, as a pediatrician, I was a little sheltered from the trauma of seeing so many people die from COVID, adults. It was less common in kids, but you are absolutely right. And how fast we were able to, thanks to, the administration and funding, to get that vaccine out there, because it was terrifying to go to work every day thinking about getting that virus, and it was killing people young and healthy like us. And, we don't have to think of it the same way because of the vaccine.
Sticker or lollipop? Which bribe works better after shots?
So we have stickers.
Stickers?
I think parents bribe their kids with Starbucks. That probably works better.
Hold on, wait a second. In your office, you offer kids a sticker?
Lollipops are a choking hazard, doctor.
Well, get a big one. Get the big one from Disneyland. You can't choke on that thing. It's like this big.
That's true. That might contribute a lot to my overhead.
Crew, we're getting her office
Stickers.
Disneyland lollipops for every kid that gets a vaccine. Can you imagine a sticker?
Yeah, stickers.
I remember when I went to my pediatrician's office and they gave me a sticker. I was like, "What the hell is this?" Like, I was like, "You're giving me a sticker?"
Stickers are a lot better than they used to be also. We have some pretty awesome
Is it at least a
stickers.
scratch and sniff? Can I get a
We
scratch and
sometimes
sniff
have
sticker?
those, sure, yeah. Or Mr. Potato Head, where you can, like, put the stickers on the potato
There's
head.
Mr. Potato Head stickers.
Yeah.
Okay, all right. Listen, all right. Clearly, I need to go to your
Anything
office.
your heart desires, there's a sticker.
Okay. What's your least favorite shot to give?
As you learned, I don't actually give the shots,
Right.
but I would say the nurses don't love giving the HPV vaccine because it stings the most. So I do a lot of convincing teenagers, preteens and teenagers that they can look at their phone to be distracted, or we have this thing called a shot blocker that is like the cough that you were saying. It like distracts the brain so that you don't feel it as much, but it's pretty painful, and some people faint, have like a vasovagal fainting episode after getting the HPV vaccine. So that one, we have to watch them for a little bit and make sure they're okay afterwards.
Do you ever feel like you abandon your patients when you just leave the room as they're getting a shot?
I do. I do.
You do?
But I try to leave them with a sense of, it's really quick and then it's over.
If you could invent a new vaccine tomorrow, what would it protect against?
This is a great question. I would love a vaccine for group A strep, different strep, that causes so much infection in kids and some weird delayed reactions, the immune response to strep, whether that's, a long time ago, rheumatic fever, kidney problems. It is a gnarly bacteria, and sometimes it is more invasive, and we see, sepsis and toxic shock syndrome. Like, there is some crazy strep out there. It would be awesome to have a vaccine. And then I might be out of a job because I won't have any sick kids, but
You're still gonna have sick kids.
yes,
Trust me.
yes. The other one that's gnarly is mono,
Mm,
Epstein-Barr virus,
yeah, it is.
and I feel like
And that
we're
causes
learning
cancer too,
more.
right? That can cause lymphoma or something?
It can
Cancer?
cause a lot of autoimmune stuff.
Yeah.
So MS has been associated, multiple sclerosis has been associated with Epstein-Barr virus, and it's like a rite of passage for teenagers, but kids and teenagers get mono on the regular,
Yeah.
and again, can knock them out of school for 6 months with fatigue. It's awful. It would be awesome to have a vaccine.
What's your favorite vaccine to explain to parents?
Rotavirus.
Okay. Which vaccine do parents ask about the most?
I would say the HPV vaccine, I have a lot of discussions.
Which vaccine gets the most myths attached to it?
I mean, again, the HPV vaccine, because it is the newest for 20 years, other than COVID, the COVID vaccine, there's a lot of things that have hung on as possible side effects that have been shown to not be associated with the HPV vaccine. It doesn't cause infertility. It doesn't cause neurologic symptoms, but people still get these weird stories.
So, I'm a parent. Let's pretend like my kids are 6 years ago, which would be so much better in my house right now. And if I said to you, you know what, Lori, I'm a doctor. I don't want any of those vaccines for kids.
I get it. It's hard to give something that you don't totally understand well to your child and you want to protect them. But these are not new vaccines. The vast majority of what we're giving, they're not new. They've been here for a long time. They are the most researched medication out there. I'm here to give you the information so that you have good scientific information, not misinformation on the internet or a story from a friend. And you ultimately have to make that decision for your child. But you're taking a huge risk by not vaccinating. These diseases are really scary. There's a reason we give these vaccines at these ages when kids are most vulnerable. So you have to ask yourself, what is your risk tolerance, right? Are you okay with your child developing a life-threatening infection? Because that risk is much higher than any minuscule risk of a severe reaction to a vaccine. it's exceedingly rare to have any severe reactions to vaccines, like 1 in a million.
What are 3 tips for parents to make vaccines easier for kids before we go?
I think you have to know your kid. Some kids do better if they're prepared ahead of time. You're going to get a shot, it's going to be fast. We'll get a treat afterwards. It's going to protect you.
Sticker.
You get a sticker and a treat at Starbucks, um, and a giant lollipop. So some kids do great with that so that they're not thrown off guard.
Yeah.
Other kids, you can't tell them ahead of time or they will ruminate on it nonstop. So those kids, you tell them at the last second. I don't say anything in the room to young kids until the very end. And then it's like, okay, we just got to get a couple of vaccines. We're almost done and we're going to get stickers. But
leave the room.
so I think parents have to know their child first off, but I think usually preparation is helpful. I always liked reading books like Doc McStuffins, was so helpful to kids, or any book that talks about going to the doctor and getting vaccines. It helps to normalize it so that they're like, oh, Daniel Tiger went to the doctor and got shots, and Doc McStuffins gives shots, and that's my stuffed animal or whatever. It helps a lot.
Yeah.
Older kids, it's a tougher sell, but don't give too much detail. You don't have to tell them that it's the most painful shot. Just give them enough information so that they feel like they're safe with you, being honest with them.
At the end, we always like to have a positive pulse. We always like to have positive spin on something.
Yeah.
Is there a positive pulse where a parent came to you and said, Dr. Livingston, thank you so much for telling me to get that vaccine. My such and such got this illness and they were really sick and my kid was fine.
I haven't had that happen. That would be wonderful.
Yeah.
I don't think people come back to tell me after the fact, but I think it is rewarding when I convince families to get vaccines in whatever way they are willing to. So, my practice requires vaccines, but we are willing to be flexible because, again, this is your child. So if you want to get one at a time in a reasonable amount of time because that makes you feel more comfortable, then I feel like I've done my job in protecting your child. So when I can help people understand the vaccines enough that they're willing to do it, even if they came in as a skeptic and really worried, and they feel more comfortable and we can have a trusting relationship, that is a win every time. And that happens a fair amount because a lot of people come in with a lot of worries because of everything they hear from friends and family and people telling them they shouldn't get their kids vaccinated. It's pretty common these days. So I like educating families about the why and why these diseases are so scary, and then they get it, and it is protecting all of these kids.
And that's what's important, you guys, is that she's armed to answer the questions of why. And if you have them, go to her office. We know where to find her. Remind everybody where to find you.
I'm at Pediatric Medical Center in Long Beach, my private practice, my home away from home, and never stop being connected, right, to that. But yes, and then social media, Pediatric Medical Center, LB, Long Beach, and we are always available on call every day of the year.
To answer your questions.
Yes.
Appreciate you guys being here. We'll see you every Thursday at 9 a.m. Eastern, 6 a.m. Pacific. Thanks for watching. We're on Instagram at the Health Exchange Podcast. Get us everywhere you get your podcasts: iHeart, Spotify, Apple, YouTube. We'll see you next time. And Lori, I'm sure we'll see you again.
Great.
Thanks.
Can't wait.